LPFM in New Orleans. We are Radio NOLA HIV with programming. That's right, programming dedicated to human rights and social justice, WHIVFM.org. We honor independent voices. We are not a radio station with a mission. No, we are a mission with a radio station, and that is to end all wars. Thank you so much for being here and tuning in. This is COVID Noise Filter, the daily hour-long show, except we do it every other day. My name is Dr. Mark Calendari, and as it says below, I am an infectious diseases physician sitting across the digital divide with my friend and yours. That would be Doc Griggs. Say hello, Doc Griggs.
Hello, Doc Griggs.
How are you? Before you answer, I actually have a couple things that we need to do. We actually have some business that we need to take care of. Eric, we have some underwriting. So we have a live promo that we need to read. So Lucille is a community-based organization, and they remind you that millions of us have rolled up our sleeves and millions are still counting on you for our health, for our loved ones, for our community. Be the next in line to get your shot. Together we can halt COVID-19 and protect ourselves and those around us. There's more information at haltcovidla.com. That's haltcovidla.com. This is a friendly reminder from Lucille, a local nonprofit organization dedicated to the well-being of Louisiana. Doc Griggs, how are you?
I am good, sir. Very good.
How was your weekend?
It was a good weekend. Went out of town, which is new, which felt different. Needed to be poured into by friends and family. It was good. I'll be glad when the rain stops. So
this rain has been nonstop for like what? Like it feels like we're living in Portland.
It feels like we're living in Portland. I got this boat. I can't even use the boat. Like it's not safe. So I need to go check on the boat to make sure it's still there.
That's right. Well, I finally got my car back after 10 months of being in the shop.
Oh, did you get an outboard motor and sails installed?
Not quite yet, but I did get it. I'm very excited. I don't know how. I will probably need a sail for it because we're continuing to flood like we've been. My poor little electric, tiny, itty-bitty, tiny little car is going to be struggling. There's no question about it.
Yeah.
Erica, over the weekend, there's so much stuff that's going on. And I know the weather has just been really, really dramatic. It's just been, now that, we have this new place and it's all windows. It's just a wall of windows. And you could just see these storms coming in. They're just really, really dramatic and really quite beautiful. But Erica, anything that you talked, were you on the news at all over the weekend or did you?
No, not Saturday, Sunday. I was on this morning though. And we talked about the migration of the symptoms of COVID-19 with this new variant.
Right.
I touched on briefly, and we'll save it for another time. How the study came out last week, and they found that this virus replicates like at 1,000-fold the viral as opposed to the original strain that came out, which means that it's more infectious, and you can see the new symptoms potentially earlier and be infectious earlier than the wild strain. The new symptoms that we're talking about, I mean, we talked before, and I'm sure we'll talk today about the resurgence of the fall, winter respiratory diseases. Well, that's what's happening now. The number one symptoms are this runny nose, sore throat, as opposed to anosmia is down. And one list and ranking, I saw it in 9th, and another one I saw it at 12th, and that's the loss of smell. Whereas before it was diagnostic. We're back really at square one. You think you have a cold or an allergy, you should go get tested for COVID.
That's exactly right. It's such a good point. I'm glad you made that point on the news today because it's such an important point. It's something I think that people need to recognize as well. And as all y'all are streaming in, thank you guys so much for being here, for being part of the show. As you guys know, our audience makes our show. Please remember to like and also share this stream. And also, I'd be remiss by not reminding y'all that podcastawards.com, Doc Griggs and my podcast, COVID Noise Filter, has been nominated for excellence in healthcare. We would love it if you were to go to podcastawards.com. You have to register and then go to the section that says health, and you'll find our podcast listed there. as COVID Noise Filter. We so appreciate you guys nominating us and voting for us in this very prestigious nomination. Eric, I think I may have told you, I actually had a patient last week that had a cold, and I told them to go get tested. They didn't, but it was because of your reporting on this that made me aware that even symptoms as mild as a common cold now can be, and I would imagine that probably happens likely to be in people who are also probably vaccinated. They get probably more these mild.
It's both. And the thing is, because again, none of this is 100%, even if you're vaccinated, and everything is dose dependent. If you're in an environment and you're not social distanced and you're not wearing a mask and you're surrounded by people that aren't vaccinated, that potentially have those sneezes and colds, the likelihood of you contracting the disease is significantly increased, and it's dose dependent. I mean, if you're wearing a hazmat suit and you walk into a room and there's even though it might be a small hole, you're 90 to 95 to 99% protected. But if there's the mist of someone actually air spraying and painting the room and there's mist, eventually you're going to get a spot. And if you stay in there long enough, you will ruin your clothes and you'll end up breathing it in because you're in a saturated environment and nothing is 100%.
Yeah, absolutely. Sorry, I'm getting a call right now. My apologies. Go ahead.
No worries.
Yeah, absolutely. Can you just hang on? Can you continue on and finish what you're saying?
Absolutely. The folks were just telling everyone to, before vaccination rates were down, the testing rates were down significantly. It was almost a drop off when the vaccines came out. People forgot they had to be tested, but testing is an essential part of public health. We can't have surveillance of what's out there if people don't get tested. And again, we're in a situation, if you find yourself sneezing, sniffling, summer colds prior to this were particularly extremely rare. I know a lot of people that have oh man, I got a summer cold. It's my first cold in a year and a half. Oh, so have you been wearing a mask? No. Have you been out in public? Yeah. You need to get tested. Why? It's just a cold. That's where we won square one before with any of this. With COVID, everyone just thought it was a cold or the flu. So it just goes to show the importance of getting everyone vaccinated and us being consistent with our treatment plan for us as a community, as a public, until we're done with this thing. You still need to wear your mask. You still need to social distance. You still need to wash your hands, and you still need to be smart. And here's the other thing. If you indeed do have those symptoms, put on a mask. I don't care whether you're vaccinated or not. If you're going to go in the public, keep your hands and your bugs to yourself.
Eric, this weekend was the running of the bulls, and
yes,
they had the nighttime version of it. And my friends run the running of the bulls, and it's something that I've been participating with since pretty much its advent.
You mean the running of the bulls? I did the running of the bulls in Pamplona in 2005. I did the real one.
Yeah, I'm not going to anywhere where they're going to kill bulls.
No. So we did the running of the bulls. You're talking about the New Orleans running of the bulls.
I'm talking about the New Orleans running of the bulls. There's no way I would ever go to an event where they kill an animal. But anyway.
No, they didn't kill the animal while we were there. So do you understand the nature of the event? Like what?
Yeah, I understand the nature. Sure, I understand.
Yeah, so it's the different corrals. Pamplona's in the hills. And what happens is, it's the largest city in the hills. So in the countryside, you have the different ranches. And what happens is they time them, and it's a race actually over the course of the week to see who can have the fastest time to get the bulls from the ranch to the corrals. And basically you're in the way. It's not like the bulls are predatory and they're chasing people. It was actually one of the theories of history is it was a here, hold my beer moment because they do it early in the morning, 4, 5 in the morning where there's dew on the cobblestone. Guy looks up, say, man, I bet you I can beat you, those bulls to the arena. I bet you I can beat you. Here, hold my beer, y'all. And it was thing.
Probably more like hold my sangria.
Right. It's called the Festival de San Fermin. When San Fermin was their patron saint, and the legend has it he had his throat cut and he was cut at the waist, which is why you wear the red scarf and the red sash and you're dressed in all white. It's an amazing festive time. I mean, it's amazing. It really, really is. But once you get over there, like yourself, and I started seeing the posters of the bullfights, and you can see pictures. No parts of it.
Yeah.
We're good.
Did you fall at all with the don't they like throw tomatoes? Isn't there like a ton of tomatoes on the
No. That's a whole separate. So I've done that too. It's called that's called La Tomatina. Tomatina is in August, and it's in Buñol, Spain, which is like it's a village outside of Valencia. Totally separate. They drop 40 tons on the village. There's a ham tied to a greased pole. Once they grab the pole, water and tomatoes for an hour. It's like Mardi Gras with throwing rotten tomatoes at each other. You're begging for water. They don't. What's interesting is once they don't even worry about stains. Acid, the acid in the tomatoes actually cleans the side of the buildings. But then you go back to Valencia and you chill on the beach. But no, they don't. For running of the bulls. It's a fully supportive environment. Like there's respect for the bulls. Like they don't want you to abuse them. But the people try to help, and then all the people that live there beg you not to do it. They say it's the dumbest thing. To this day, it's been going on forever, but they're like, this is the dumbest thing that people ever do. They get hurt. You can get hurt, blah, blah, blah. But it was quite the event. And then that was in 2005, like right before Katrina. And then after that, of course, they started the event here with the roller girls, which is kicks always.
Right. And so that's where I pick up on the story. And my friends have been doing it since the very beginning. And so because they didn't do it last year, pandemic, and then this year they did kind of a nighttime version. They didn't do the morning version. 600 people at the sugar mill. I was the only one wearing a mask. In fact, I left early because, I drum it. I do the music for it. And I was the only one. We walk in with the procession. I was double masked. Yeah. Right, and the only one wearing a mask. A couple people were like, "Oh, he's an infectious diseases doctor. If he's wearing a mask, we should probably be wearing masks." So
you think
afterwards and said, "Dude, when we saw you wearing a mask, we're like, he knows something we don't, so we should mask up." But I ended up, Liana and a friend was going to go, and I ended up calling them and telling them not to come. I was like, absolutely not. Too much of a risk. We're going to go through the numbers right now, but it's just too much of a risk, and I felt uncomfortable. I'm not saying they didn't do it. They did everything appropriate. They followed all the laws, letter, to the T. Everything was exactly appropriate. But I just do not feel comfortable getting into a room of 600 people at this point, and that was. They hit their limit. They did everything appropriately. There was in no way did they do anything appropriate. This is a me thing. I just don't feel comfortable being in that space yet. And so it was crazy. It was nice. It was nice to sit and drum, and it was nice to have some level of normalcy, if you will. But it was a little odd, to be honest with you.
Hey, I got a quick question, and because it came up in a conversation today. So you can't charge for a vaccine, right? Right? The vaccines are free, correct? So what about testing? It's still supposed to be, all this is supposed to be free, right?
No, testing's not free. I mean,
testing's not free. Okay.
It depends on where you go. I mean, like if you go to a doctor's office, they're going to probably charge you because the doctor has to buy the test. I mean, the only free tests are the ones that are at public sites. But if you go to an urgent care, you're going to get charged. If you go to Ochsner and you're not like a regular Ochsner patient, but you just go to one of their urgent cares, they're going to charge you.
So the thing is, though, I'm still pushing people to get free testing, to get the free go.
I don't know where there is free testing.
The testing at CVS isn't free?
I don't think so. Because I think they have to pay for, because they have their own services they have to pay for. I mean, you can look it up real quickly right now, but I think the testing that there is really testing that's at like if you go to nolaready.com and see where the testing sites are.
So this is from April 28th. Like the coronavirus vaccine, testing for COVID-19 is free to anyone in the United States, including people without health insurance. The Department of This is everywhere. The U.S. Department of HHS has partnered with pharmacies and retail companies across the country to provide free, accessible testing. Information information about testing by state is available on the department's website. The patient responsibility is waived. If they have insurance, insurance will be billed, but the patient portion of what might be their deductible or copay or co-insurance, which can vary, is currently being waived.
I mean, I know friends
That's
that when they go to an urgent care, they're going to get charged for their test. So maybe it's pharmacies.
I'm going to go to the HHS site, because again, if we're going to be pushing people to get tested, it turns into it becomes an equity thing, right? It turns into a barrier to access, which started this crap to begin with. And I remember it was supposed to be free.
Yeah. I mean, again, yes. I mean, my friends went traveling last week and they had to go get a PCR, and they paid top dollars at an urgent care to get a PCR so that they can get into the country of their choice.
So you go to CVS, and I've had the testing at CVS and haven't paid a dime.
Okay.
Which is interesting.
You know better than me. The testing that I've gotten has gotten through Access Health. Right. So I haven't, that's where the testing has been.
I'm going to the HHS.gov site now, and we can keep going. All right.
Well, let's go ahead and get to. We got a lot of content to cover. Let's see. Let's go here. So this is the public health update that I gave on Friday. So it's a little out of order. It's a little different than what we're used to seeing. So that's not right. I got to change that. All right, Dr. Riggs, we are looking like we are in another upturn right now. So this would be one wave, first wave, second wave, third wave, fourth wave. And what does that look like to you, Eric?
It looks like another wave. Hi.
It looks like it's starting to pick up again.
It's waving at me, so I'm waving right back. There it is.
186,782,156 cases with 4 million. Yeah, we crossed that 4 million mark. 4,030,857 deaths globally. When we look at the global wave, we are seeing that it's still trending downward. The thing that's most interesting is if we look at, again, hotspots, the top 12 countries with the cases that have the most cases are spread all over the world, right? So if you look at Middle East and Asia, right, you're looking at Cyprus, Kuwait, Mongolia, and Oman, right? So just places that are just all over the place. In Africa, it's Namibia, South Africa, Botswana, and Tunisia. When you look at Latin America, it's Colombia, Argentina, and Cuba. When you look at Europe, it's just the UK. So what this tells me is that these countries are all over the place, and Delta is all over the place with them. This is not one of these things where it's going from one country to the next country to the next country, like we saw with the first wave, or like we saw in Europe, or what have you. We are seeing pockets of communities, or at least in this case, countries, are being affected, and I think that's what we're going to start seeing here in the U.S. As well. So yeah. So it's really fascinating, and I love looking at these hotspots as well. Anything about that, Eric? I mean, just the idea of just like how these countries are all over the place.
No, I mean it has this. To me, it's showing convergent evolution, right? But it's also showing the effects of travel.
Yeah. Yep. Travel. That's a good point as well.
Effects of travel and scarcity of vaccine and unequal distribution of vaccines.
No question about it. So 25% of the world population has received at least one dose of a COVID-19 vaccine. 3.35 billion doses have been administered globally, and 31 million are now administered each day. Only 1% of people in low-income countries have received at least one dose. Can you believe that?
Wow.
You look at the countries that have had some of the highest rates of vaccination, you see South America or Latin America is, but you have to ask, why is it that we see such high rates of cases there? Like, we see right here, we see high rates of cases here despite being already very highly vaccinated. And the answer there is that either one, the vaccines are, there's some vaccine failure, which could be an issue, or two, it could also be that we're just dealing with variants that are able to evade vaccines.
And or three, you're dealing with countries that no matter what, we can give all the vaccines that are possible. None of them are 100%. And if social distancing is a privilege of the haves, no matter what, if you vaccinate people and there are 20 people, 25 people living in a 1,000 square foot house, and social distancing is not an option, it's going to spread. It's kind of like what we're talking about, being in a saturated environment. So there's a lot of factors involved. A lot of these are resource poor continents and countries, or let's say equitably distributed resources. They're resource rich continents in some countries, but the resources are unevenly distributed. And as a consequence of not having the luxury of social distancing, the proximity, the virus doesn't spread the virus, people spread the virus, and none of these vaccines are 100%. Eventually, because of the nature of natural selection and evolution in nature, the virus is going to figure out a way to get around it.
100%. And Tomeko agrees with you as well as do I. Very, very nice and nuanced summary there. Thank you, Eric. Real quickly, just to answer Fetty's question, how popular, useful is COVID wastewater analysis?
Start with the useful first.
Very.
Now talk about why it's not as popular.
Well, it's wastewater. But I mean, it's popular. I mean, people have the mechanisms. I mean, we could do it here.
Well, I was going to say one of the reasons it's not popular. You hit it on the head. I mean, just from a practical people perspective, it's wastewater. But the other thing is that we can do it in countries with the resources. It can be amazing. But in countries that don't have if they don't have resources for testing or vaccines, the likelihood that they'd have a lab to do wastewater analysis to take it that far. Remember, we were waiting for a while for certain countries to light up, even though you knew it was there, but they just didn't have access. So a lot of this stuff is, I'm not going to harp on everything through an access lens today, but it plays a lot into it. If we haven't learned anything about the social determinants of health and how the world is run from a capitalistic perspective, then I guess we're going to be in class a lot longer.
I think so. Starry says, based on the chart, would it be safe to travel to Israel? Israel's undergoing a big wave right now. Hard to say in terms of travel recommendations. I think that everything's a measured risk at this point. Right?
Yep.
And I think this is the chart that maybe that they were talking about, looking at the people who've been vaccinated, UAE, Bahrain, Israel. It's really interesting that the Middle East really is the top 3 countries for vaccinations come from the Middle East. The next 2 are really UK, US, and Germany. But yes, it's super fascinating. All right. US here, 34,739,435 cases with deaths, 622,869. Our cases are down to 8,000 cases and 37 with deaths being 44. It's really profound. And you can see such a decline in cases, really, really profound. We're starting to see a little bit of an uptick here, but we'll see what that does, if that really does anything or not. I thought this was going to be an uptick, and it ended up being not. So hard to say, but only 48% of those that are all ages and 59% of 18 and above are fully vaccinated. So we're still not seeing what we need to in terms of vaccinations. Doc Riggs likes to talk about testing. You can see our testing has gone significantly down. We do need to kind of remind people that testing is still important. Hospitalizations are going down, and thankfully deaths have been going down as well. So that's all super good news. Looking at vaccination rates, it's just really unbelievable. 332 million doses so far, with 604,300 day.
So I got an interesting stat that just popped up on the TV screen. The average COVID cases have jumped 47% in 1 week, up in 36 states.
I believe that. I believe that. And wow. I bet you we could probably predict those states based on the color of these, right?
Yep.
But look at Mississippi and Alabama. Just look at Louisiana, Alabama, Missouri, Oklahoma, Idaho, Wyoming. It's hard to see all this, it's unfortunate. There's no question about it. That there's this, massive vaccine hesitancy.
Missouri Hospital Group has a highly contagious Delta variant to blame for explosion of COVID cases.
There you go.
Springfield, Missouri.
And there you go. And look at Missouri right here. It is, I wouldn't say it's wonderfully vaccinated. It's not poorly vaccinated like Mississippi and Alabama. I mean, look how white these states are.
Actually better vaccinated than we are, sadly.
No. You want to? Oh yeah, Missouri is better vaccinated than we are. Yeah. More or less the same color, but yeah. Look at here in Louisiana, 789 cases on Friday. 789. It's like almost 800 cases. That's insane. That's insane. And look at the places. I would not have expected these to be the hot spots, right? I would have expected this area to be the hot spots. But listen, the one thing that you should learn to expect is that you have to be surprised, right? Yeah. Look at the highest region of vaccination. Almost 50% is Region 1. And look where one of the hot spots is, squarely in Region 1. It's just weird, The other two regions have vaccination rates below 35%. Of course, the Baton Rouge area has a vaccination rate approaching 40%, but everything is underneath 30%. It's crazy. Any thoughts on that, Dr. Graves?
No, I mean, you expect the unexpected. We just need to get a uniform approach to all this with vaccines, testing, masking, social distancing, blah, blah, blah. And I don't know if we'll ever get a unified message.
Yeah. Look at the cases. Look at the cases in Louisiana. Oh, I did come up with a good one. I just saw this, and I wish I pulled the article, but it was an early article looking at people who've had long COVID may also be men who've had long COVID or have had COVID may be experiencing erectile dysfunction.
Wow. Yeah, well, that makes sense. If this is this is the disease of the blood vessels. So
this could be another. Here's a good reason to go get vaccinated.
Let's make a campaign. If you want guys' attention, that's what you talk about. You will. The numbers will go up. They will definitely get vaccinated.
But not going up in this direction. Not this.
Not like this. No, we're talking about vaccinations.
Yeah, but man, that is insane. And what is this bar right here? This bar is what? That's the 2,000 mark. So you can see kind of broaching 2,000 up there. And in Louisiana, fully vaccinated, all ages is 36%, 18 and up is 46%, and at least we've matched the U.S. for 65 and up. But holy smokes, man, we don't have enough people vaccinated. And what we've said before is this virus will prey on the unvaccinated. And I think that's what we're starting to see here. I think. Hopefully I'm wrong. We'll see. Let's see what else we got. Looking at Louisiana, we are at 15.4 per 100,000. We're now in the high risk. Remember when the high risk was red?
Yep.
Now they've got high risk orange. It's like severe, and it's like infection rate is 1.32. So it's above 1. That means that there is an exponential spread. And testing rate is 6.8. It's over 5%. So we're not moving in the right direction right now. And this is why we're listed as being high, as opposed to Louisiana, also or Orleans Parish rather, also listed as high. But 5 per 100,000 infection rate is above 1, but it's not as high as it was in the state. Positivity rate is over 5.7, or is less than 5. and vaccinated, at least with one dose, is 54.1%. So the best in the state, but we definitely have a lot of work to do. So this is kind of where we're at. Before we go on to talking about vaccines and variants, Eric, I wanted to give you a chance to put any words in.
Sorry about that. Yeah, sorry about that. The bottom line is that we're going in the wrong direction slowly. We are standing on the train track and we see it. It's miles and miles away, but we hear the horn. We hear it, and we're starting to see it get closer. And it's not your eyes. It's not your glasses. It's going up. We're doing exactly what happened in other countries.
At least right now. I mean, we predicted that when the Alpha variant, we never got the big boom, which is really mysterious. Why didn't, a lot of these other countries got affected by Alpha and we never really did? It's really fascinating. And that's the sort of thing that we'll find out at some point in the future. But at this point, we need to be very cognizant that this Delta variant is there. And in fact, that's what we're going to segue into, because I think, and what Doc Grizz is saying is, I think that's what we're actually seeing. So where is the Delta variant spread to? The Delta variant, which is believed to be the most transmissible variant yet, has now spread to over 100 countries worldwide. And what you're looking at here in these percentages is the share of Delta variant over the past 2 weeks based on analyzed sequences. So this is not to say that 93% of that, it makes up 93% of all cases. It will in the US at some point very soon. That just means that 93% of all of what they looked at for the past 2 weeks were made up of Delta. And you can see those numbers are pretty much shared around the world. So this Delta variant is very significant. It's fascinating that's even pushed out the B1351. Geez, I forgot is it?
B1351.
B1351, yeah. It's pushed out. That one is what? That's a alpha, that's a beta, or that's gamma, right? That's gamma. I think, yeah, it's
gamma. Yeah, that's gamma. That's gamma.
Okay, so it's pushed out. It's pushed out. But then also look at this. India has also declined in India, even though this is where it originated from. So this is fascinating.
Yeah, but is that, when you look at this, does this include Delta Plus? Because is Delta Plus becoming the predominant strain as opposed to the regular Delta in India?
It's a good question. It's a very, very good question. I hear you on that. Comparing variants of concern, all viruses, SARS-CoV-2 coronavirus has been evolving since it first emerged in 2019.
Beta is beta, South Africa.
Right. The WHO identified 4 variants of concern: alpha, beta, gamma. So that's the P2 or P1 rather, and then the Delta is B1617. We've been talking about that you're going to hear a lot of. And then Eric, you were asking about what happened. How did we get to Lambda? There was Eta, Iota, and Kappa. So these were the strains that were variants of interest. So that's where that came from. In terms of where these variants are, you can see alpha is spread throughout the entire country. You can see the Delta variant is actually getting there. The numbers that we're seeing here are really, really impressive, right? It's 115% more transmissible than the wild type virus, right? We don't know yet if it can cause more severe disease. Vaccines, thankfully, are mostly effective. This is the beta variant here. First discovered, no, wait a second, that can't be right. They said beta, they just said up here, beta was South Africa.
Yeah, there might be another one. They also said that Kappa is in India as well, but these are variants of interest, which means that they're keeping an eye on them.
This was, but one of these are wrong. Look, they got beta variant 1351.
Oh, South Africa.
They got beta variant. Yeah. My apologies. No, that is correct. My apologies. I don't know what I just had a brain freeze. Beta variant is 1351. We can see that it fortunately has not transmitted widely throughout the U.S., but the P1 variant really has transmitted pretty well across the US. So those are super interesting. And these are these other so-called variants as well, the iota, the eta, the zeta, and the epsilon as well. So things for us to think about. Eric, I wanted to show you this. This is the gold right here is the virus that emerged out of Wuhan, right? And you can see here already it was being pushed out by another variant, but eventually 1351, I'm sorry, B117, this is the alpha variant, and this is the so-called California variant right here, choked out this Wuhan, the variant that emerged out of Wuhan. You can really see 117 really being the dominant strain here. And you can see this is up to early April. Now what does it look like? Look at that. It is completely gone. It is all 16172. It's all Delta variant. The Delta variant is the dominant variant. Look at it. We don't even have these other colors anymore. The variant now is P2, is P1. It's the 1526. Again, I mean, those are gone. That's the California variant. Then you got 117. So look how Delta in such a short period. Look at what didn't even exist here, right? Yep. Look at nothing in April. Look how fast it has taken over. So
it's a picture of evolution and natural solution, natural and artificial in the sense that if we talk about the created immunity from vaccines, but this is what happens in nature.
Absolutely, it's such
nature
a good
finds a way. Yeah.
Such a good point. So here was an article. I'll just have the headline: the Delta variant is a grave danger to the unvaccinated. One half of America is protected. The other is approaching a perilous moment in the pandemic. This is something that you and I talk about all the time, but I just thought that was a nice, it was a headline that I know people who are unvaccinated, their eyes are going to just gloss over it, unfortunately, but it's still a very, very powerful headline, and it's one that I'm particularly concerned. So here was a study that looked at how effective antibodies that were generated as a result of vaccines were. You can see this was published on July 8th, so very new. A peer-reviewed report from scientists in France published Thursday in the journal Nature found that Delta variant has mutations that allow it to evade some neutralizing antibody produced by vaccines or by natural infection. A single shot of a 2-dose vaccine barely offers any protection, the researchers noted. So there's a couple of caveats here. One is one shot of the COVID vaccine for a 2-shot vaccine, either the AstraZeneca or the mRNA vaccines, are not effective. You definitely need a 2-shot vaccine. Now, we are seeing some evidence of evading the immune system, but we have to be clear, we don't know what that, how strong of an effect that is, right? I mean, we don't know clinically, but we are seeing evidence that the Delta variant does possibly evade some vaccines, and particularly I'm talking about the mRNA vaccine. So that is something for us to consider and just be aware of. That's all. Just be aware of. All right. So this was a study in Nature showing that there was reduced sensitivity. Again, what we don't know is what does that mean in terms of clinical. What does it mean clinically? Here is another study: infection and vaccine-induced neutralizing antibody responses. And again, here was another study. This was in the New England Journal. And what they found was that the Delta variant was 6.8 times less susceptible. So this was the 0.1 and 0.2 was 2.9. So 3 times less susceptible to neutralization by those individuals who recovered from COVID. So in other words, people who had natural antibodies and from vaccinated persons against what is now being referred to as the Wuhan A1 2020 variant. So again, what all this really tells us is that we know that there's some vaccine evasion that is happening. We just don't know by how much. I would not worry at this point. We have seen people who have been vaccinated. They are getting COVID again with this Delta variant. But like we said at the top of the show, the symptoms are much more contained and much better tolerated. Eric, any thoughts there?
No, you're spot on with everything you're saying.
Okay. We had, I know that I forgot who asked us earlier about Israel. I think it was Sorry, who said who asked us about Israel. So here's a story about Israel that I had prepped. Explanation about the effectiveness of vaccine for coronavirus in Israel. Data released this week by Israel's Ministry of Health showed vaccine efficacy against the coronavirus is waning in that highly vaccinated country in tandem with the spread of the Delta variant. The Israeli data show lower protection against symptomatic illness. The Israeli data show lower protection against symptomatic illness. Only 64%, although vaccinated people do retain protection against severe illness. So the way to interpret this essentially is what we know is that you can likely get infected or reinfected, but what the vaccine will protect you from is severe infection, hospitalization, or mortality. And so there's some good news there. And I will just say this: hold, because we don't know what the next variant will do. But right now, I think we're pretty well protected.
Yeah, right now. But the longer it takes for people to get vaccinated, the more likely we will have other variants, but that they can become of interest or of concern, particularly with what we talked about earlier, that the viral loads being 1,000 times that of the original or the A1 wild strain, meaning that when you get infected, it replicates a lot faster, so there's more of it. It binds to the receptors more, so you'll feel symptoms and that you can be more infectious and you can get it to other people. So get vaccinated.
That's the final word.
Wear a mask and stay away from crowds and wash your hands.
All right. Citing the Delta variant, Pfizer will pursue booster shots and a new vaccine. Scientists were critical of this announcement, pointing to evidence that the current two-dose regimen is powerful, effective. Oh, you can't see it? Sorry. Sorry. Thank you for reminding me.
Yeah, the World Health Organization talked out against that today. They've been talking about it, but they came out specifically and said some of the reasons why is that they could trigger a neurologic syndrome that rare with a booster. They just don't know. There's just not enough data. They're saying they just want to push back and get everybody vaccinated, right?
Right. So what's your thought about? I mean, do you see this as you and I just made an animation about the need for booster vaccines. So I have I don't know what to think about it. Well,
we're ultimately we are going to need a booster, and in those boosters, you want to make sure that you cover the new variants that are out there. The problem is you have to pick. Your timing has to be correct in that you have to have given enough time for enough people to be vaccinated the first round in order to be fully protected and to make sure there aren't evolving that's why they have the variants of concern and variants of interest. If they move from the of interest category to the of concern category, then those would need to be included in the booster. What would be sad is you get a booster today, and then all of a sudden Lambda pops up and becomes a variant of interest in 3 weeks. So now you got to get another booster? So you're going to keep doing this? And that's what they're talking about you're going to keep triggering this antibody response in the body, this inflammatory response, along with everything else that goes along with your immune response. And what does it look like to take that monthly if it's different? What are your risk for side effects could go up. Not saying they will, but time is our friend right now. So if everyone would get the vaccines that we have with the understanding that we're going to evolve to needing a booster, I think would be good.
Absolutely. And in fact, I think I do have a story in the rundown about is it Janet Yellen, I think, is asking for the globe to get vaccinated because finally they're recognizing that if they really want to have economic recovery, the whole globe needs to be vaccinated. Otherwise, we're going to be in this continual push-pull situation that we're in right now, especially as we start seeing people kick out new variants. Speaking of new variants, how does the Delta plus variant as SARS-CoV-2 compare with the Delta variant? A novel SARS-CoV-2 variant, the Delta Plus, has been identified in over 10 countries. Health authorities are raising concerns that the variant may have an increased ability to transmit, but they also note that transmissibility is likely similar to pre-existing data. But the Delta variant is a sublineage of the Delta variant with only no difference of the K417N in the virus spike protein, makes it so that it allows to infect healthy cells. And one of our colleagues, Dr. at LSU, Dr. Jeremy Kamal, was quoted suggesting to the BBC that the Delta Plus might have a slight advantage in infecting and spreading between people who were previously infected earlier during the pandemic or who have weak or incomplete vaccine immunity. But he also noted not much from this Delta variant, and other experts have raised the third point, probably the most effective and the one that we need to really consider, is that the Delta variant is not active against monoclonal antibodies. So if you were to be treated, get sick, and you were in the hospital, the monoclonal antibody treatment is not likely to be as effective.
Yeah, so you have to be in the hospital and be sick, like it's a niched population of folks, but it's something that we need to know no matter what.
Yeah, absolutely. And then the final big variant that everybody's talking about right now is the Lambda variant, worth watching, but no cause for alarm, spreading fast in South America. The variant is still a mystery. No one knows whether it's more contagious than other variants or if it affects the vaccine. So that's important. We don't know yet. But in recent weeks, a growing drumbeat of news coverage has started to raise alarm about Lambda, first detected in Peru. The World Health Organization has named it a variant of interest, meaning essentially experts suspect that it could be more dangerous than the original wild-type virus. As of middle June, Lambda is reported in 29 countries, detected in 81% of COVID samples in Peru, and 31% of those in Chile, which is amazing, right? But less than 1% in the US. Preliminary lab studies, which have not been published in peer-reviewed studies, show that there is a concern in reinsurance. They found that antibodies induced by Pfizer, Moderna, or CoronaVac vaccines are less powerful against Lambda than against original strain, that are still able to neutralize the virus. The findings suggest that these vaccines should still work against Lambda, but as with most things, we need to wait and see what the final data shows us. Any thoughts before we pivot and transition to some current events?
No, we can pivot right now. It's covered, and we'll just have to watch and see.
Okay. All right. So now for our current event, scientists believe that they're starting to understand Delta more. They seem to mostly agree it is the most contagious, spreading now 225% faster than the original. I've never seen that number before. This is the highest I've ever seen it.
Yeah, that's pretty big. It was 67% more contagious. Well, that makes sense, though.
Yeah.
Yeah, if the B117, I don't remember the Greek letter alphabet for it, if that was 60% more infectious and Delta is 60% more, so 225%, that's an interesting number.
Yeah. I just was adding them, but you're right. Maybe there's more than an additive process.
Yeah.
A new study says Delta grows faster in your respiratory tracts to much higher levels. On average, people infected with the Delta variant had 1,000 times more copies of the virus. This is what Dr. Rick was talking about a moment ago, in their respiratory tracts than those infected with the wild type. Also, when someone catches the Delta variant, they become infectious sooner, taking about 4 days to reach detectable levels compared to 6 days for the original. So we are learning some new things about Delta. There's no question about that. And certainly very, very interesting. Pfizer about to seek U.S. authorization for a third dose of its vaccine, saying another shot within 12 months could dramatically boost immunity and may help ward off the Delta variant. This will be interesting to see if this is something that actually pans out or not. I'm not 100% convinced at this point, and we definitely need to see the data. This is the kind of thing that makes it hard to track accurate coronavirus information. Connecticut health officials say they will no longer provide daily updates on the number of people who've died in that state. Their reports will now only come out once a week. I have no idea why.
So wait, now I want to read that carefully. They didn't say they would stop tracking it. They just said they're just going to stop reporting it out to the general public daily. So my thought is they'll still keep track of these numbers and adjust accordingly. It's just they just won't saturate the airways with it.
Sure, that's fair enough. That's a fair reading of that. I totally understand that. Los Angeles County Public Health Director tells NPR vaccination rates are lower in Black community as a result. The community is experiencing a rise of COVID-19. This is a time when cases and hospitalizations went down for Latino, white, and Asian residents.
We're pressing reset and starting from scratch again. Like but it's a smaller subset of people. Now it's the unvaccinated, and because of that, and there's no masks and everything's lifted, you're going to see what we saw at the very beginning in a subset of people until it grows to the general population. It's crazy.
Absolutely. Don't bother heading to Japan for Olympics, as anticipated. Spectators will not be allowed. Japan has declared a state of emergency. Did you send me this? That like six athletes have already tested positive for COVID.
I might have. I don't know, dude. I read so much and send over. I don't think I sent you that one, though. I read that one.
Maybe I just read it, yeah. Los Angeles County spike COVID continues Saturday, the second consecutive 1,000-plus daily tally of infections. Friday number reported a week before, and the county's highest daily figure since March. The numbers especially are alarming because tallies are usually lower on weekends since there are fewer tests lags in reporting. Thousands of Cubans took to the streets yesterday in protest. That's a rare thing in Cuba. They were expressing frustration over pandemic restrictions, the pace of vaccinations, government neglect. The Cuban president, also head of the Communist Party, blamed the United States for the unrest. We love our brothers and sisters in Cuba and really hope and wish for the best for everybody over there in Cuba. The CDC says fully vaccinated students do not need to wear masks in classrooms this fall. This guidance is aimed at keeping kids in classrooms, participating in sports and extracurricular activities. The CDC encourages a return to the classroom, even if not all prevention measures can be taken. For unvaccinated students, mass hand washing and weekly COVID-19 tests are recommended.
So does that mean?
You know what's there? Mandating or strongly recommending vaccines for kids who are going back to school.
Yeah, so here's the thing. Everyone who's in the 5th or 6th grade and under, basically they're gonna have to wear masks, and because there's no vaccine for them. We don't have one that's authorized for them yet. So just say that pre-K and below, you gotta wear a mask, weekly testing, COVID precautions from pre-K through 5 or whatever.
Right.
They just convoluted it, the messaging.
Yep. What do you think about the fact that they're not mandating vaccinations for kids that can take them?
They're not mandating vaccinations for kids that can take them. I mean, that's just and how long are kids going to wear masks? I mean, who's going to be policing that? You're going to tell a 13-year-old or a 15-year-old to wear a mask? Like, that's just not going to happen, And so it is problematic. I trust the CDC. I know I've said that before in the past and we've been burned, but we have to trust that they're looking at models that are suggesting that this is going to be all right. And what's happened in other places. And because when I understand, everything's going to be going back full tilt.
Right. The locals are happy in Japan. They are very scared and they're not vaccinated. That is kind of scary. Cuba announces its Abdallah vaccine is 92.28% effective. That is great. Abdallah is the protagonist of the dramatic poem of the hero of the Cuban Revolution by Jose Marti. Mambisa is a vaccine administered as a nasal spray. It's named after anti-colonial Cuban guerrillas. Let me see what the rest of it says here. Who fought against Spanish colonial rule. That's interesting. Thank you, Fetty, for sharing that. Thank you, Tamiko, for sharing that as well. All right, let's see. We are getting closer and closer to England opening up. They are moving towards what they are referring to as Freedom Day. The vaccine minister says even after that 19th, masks will still be expected in crowded places like transport. This represents a toughening up of the rhetoric. It also advised people to not rush back to offices if possible. The health secretary predicts daily infection levels could top 100,000. Wow, a record. And then one last story about what's happening in Tokyo. Let's see. Even more problems in the Olympics in Tokyo. Organizers were going to allow the sale of alcohol at venues, but the public said, wait a minute, citizens are still under alcohol restrictions. Why is it safe for Olympic spectators to drink? I thought there were going to be no spectators. Plus, there are concerns alcohol will make spectators yell more and ignore social distancing. So sale of alcohol at Olympic venues have been banned. It's a really super local story. Tamika, I would love some feedback on that as well, because that is a very, very local, highly local story. And as we kind of are wrapping up here and turning the corner and landing this plane, let's see. Pfizer officials will meet with U.S. scientists about booster shots, which officials say aren't necessary now. England will lift COVID restrictions. Yep, FDA will add a warning about a rare nerve syndrome to Johnson & Johnson's vaccines. The regulators found that risk was low. U.S. doctors had a ration of last resort COVID treatment, forcing stark choices. Did you hear about that? And then here's what I was talking about as well. Janet Yellen calls for accelerating vaccination worldwide to help economic recovery. So yeah. So I think we're all kind of caught up there. We can do some more stories if you want. Eric, where are you with things?
I want to go back to that last slide. Please.
Okay.
Go back up. 1, 2. I think it's the fourth one. From the bottom, go up, up. I want to go back with the last resort treatments was what?
Forcing stark choices. Doctors had a ration last resort COVID treatment. You want to jump to that story really quickly?
Yeah. I'm curious about that one.
I think they were trying to use ECMO.
Oh wow.
Yeah, I think that's what it was. So we'll explain ECMO in a second. Throughout the pandemic, wrenching scenes have played out across the U.S. as doctors found themselves in the unfamiliar position of overtly rationing a treatment. But it was not ventilators as initially feared. Concerted action largely headed off these shortages. Instead, it was limited availability of ECMO, which required ECMO stands for.
You got me on that one. I've forgotten that one.
Extracorporeal. Essentially, it's meant to give your lungs a break. You have basically one tube that removes blood from your heart, and another tube that puts back into your heart.
Yeah.
It requires expensive equipment similar to the concept of heart-lung machine and specialized treatments.
Extracorporeal membrane oxygenation, out of body supplying of oxygen to the membranes.
So basically, it's allowing your lungs to rest.
It's doing your lung work. Yeah.
Patients died because they could not get ECMO. This spring, she was overwhelmed with requests to accommodate patients who may be good candidates for ECMO, and we could not accommodate them. Doctors try to select individuals who most likely benefit from it. It's a last resort treatment that is mechanically substitute for badly damaged lungs. Dozens of interviews with medical staff and patients across the country reporting inside 5 hospitals that provide ECMO revealed that in the absence of regional sharing systems to ensure fairness and match resources to needs, hospitals and clinicians were left to apply differing criteria with insurance coverage, geography, and even personal appeals having an influence. My goodness, right?
Wow.
Anyway, this is something that we had talked about. We knew was something that was going to be problematic. We knew that we were going to have to ration care when it came to health. ECMO is, of course, very, very highly specialized. But Eric, we have to go.
Okay.
Are beyond our time. Everybody, peace out. We'll see you guys on Wednesday. As always, thank you for joining us. And health is a human right. And get checked if they get moving. Bye, guys.